This video is an overview of the AMPLIFY clinical trial for patients with prostate cancer who have a rising PSA level after their initial cancer treatment. You may be eligible to participate in this trial if you have prostate cancer and have been previously treated with surgery, radiation, or other types of prostate cancer treatments. PSA is a substance normally produced in the prostate gland that can be measured through a simple blood test. After completing initial prostate cancer treatment, doctors check PSA levels to monitor how well treatment has worked. If PSA levels remain low, it usually means the treatment was successful. However, if PSA levels start to rise, it may suggest that the cancer has returned. In that case, follow up tests such as imaging or biopsy may be recommended. Standard imaging tests like CT and MRI can identify the location in your body where the prostate cancer may have spread. However, those tests may potentially miss the spread of cancer, which could lead to suboptimal treatment. This is where a PSMA PET scan can be beneficial. A PSMA PET scan is an advanced imaging technique that may help doctors see areas of prostate cancer spread more accurately. Before a PSMA PET scan, doctors inject a small amount of radioactive tracer into the body. This tracer travels through the bloodstream and accumulates in areas where there is a higher concentration of PSMA, such as prostate cancer cells. The PET scanner then detects the signal emitted by the tracer, making it easier for doctors to see where the cancer may have spread. However, the currently approved PSMA PET tracers may not always detect all areas of cancer spread. Copper 64 SAR bis PSMA is an investigational PSMA PET tracer that was specifically developed to potentially see more prostate cancer spread on PET scans. Copper 64 SAR bis PSMA may offer some key potential advantages over other PSMA PET tracers. Unlike other tracers, it stays detectable in the body longer, which allows for imaging at both approximately 1 hour and 24 hours after the injection of the tracer. As a result, Copper 64 SAR bis PSMA may provide more accurate images and additional information that could lead to better detection of cancer spread, which is important information for doctors to use in determining optimal treatment plans. On day 1 of this clinical trial, patients receive an injection of the tracer Copper 64 SAR bis PSMA. Within 1 to 4 hours, a PET CT scan is performed to capture detailed images of the prostate, nearby areas, and the rest of the body. On day 2, patients return for a second PET CT scan, approximately 24 hours after the first, to evaluate the potential benefits of next day imaging. Doctors will review the images to look for signs that the cancer may have returned. Based on the results of the scans, you will be followed up during the trial to confirm whether the findings from the images are prostate cancer or not. This may involve additional scans or other treatments. After completing the clinical trial, you will move forward with the continued care recommended by your doctor. The primary benefit of enrolling in this trial is the potential to receive a PSMA tracer that could be more accurate at detecting prostate cancer that may have returned after your initial cancer treatment. Another benefit is the contribution to the development of a new potential diagnostic tool aimed at improving the detection of cancer spread in prostate cancer patients, with the goal of creating more accurate treatment plans that may improve outcomes for patients with prostate cancer. To learn more about this study, talk to your doctor or scan the QR code shown here.